So this is my patient who was 10 months old when he was first brought to me. Before surgery, there was poor vision. The baby was very irritable and crying because he was not able to see clearly. And earlier the surgery is done, better the outcomes in giving vision to prevent blindness. So I did the surgery immediately when the baby was 10 months old. After the squint surgery, you can see straight eyes, as we can see. And this is a sight-saving operation to make the baby see. The irritability and crying was gone as the baby could now see. Parents and relatives were very happy because the eyes are straight and cosmetically good after surgery. You can see the difference, the pre-operative and post-operative. I just want to emphasize this is very correctable surgery. The eyes are connected to the brain through the optic nerve. If the eyes are crossed, each eye is looking at a different object and the brain gets confused by looking at two images. So the brain starts to ignore both the eyes, and that's what results in amblyopia or partial blindness. So eyes, optic nerve and brain are in coordination with each other, only when the eyes are straight. So only then the most important function called vision, sight, happens. And this was achieved by surgery and all are happy now. This is another patient of mine from Dubai, 5.5 years old, who had only 10% vision when he came to see me first, and he had squints in both eyes, very large squints. He was also very inhibited because he was teased in the schools. And I had to do the surgery at the earliest because already he was very much delayed in coming to me. He's been having the squint from the age of 6 months. And so I did the surgery under general anesthesia immediately. After surgery, you can see the eyes are straight. And the good thing is vision improved to 100% in 1 month. The boy became very confident because the surgery made a difference in his looks. The parents and child were happy. He was a happy child now going to the school. So these are the pre and the post squint pictures. And this is another gentleman, 26-year-old patient of mine from Sri Lanka. He had squint, very large ones in both eyes. In addition, he had poor vision in one eye. And because of all these, he was not getting a job or getting married due to the cosmetic effects. Since he was not financially sound, he requested me to complete both surgeries in the shortest time possible to reduce his stay in Chennai. So I did a video call with the patient and asked him to do the necessary investigations and got fitness. Day 1, I did the right eye. Day 2, I did the left eye. And day 3, after the checkup, he left for Sri Lanka, a very happy man, since his surgery was successful. And I had also given him a huge concession. So within 1 month, he called me. In fact, he has put a video on my Instagram and said he was very happy because he was no longer shy to socialize. He also found the right job and his marriage was also fixed within a month. So this is a patient who is 24 years old who visited me only last month from Chennai. She had squint in both eyes. In addition to all the above problems, she also had double vision, that is diplopia. So she was very keen to get the surgery immediately. And this was a very challenging case because each time I measured the angle of squint, it showed different measurements and very misleading. She also had previous surgery and most of the patients don't have the previous records. So what do I do now? But meticulous planning and many years of experience guided me on the right path, and hurrah, I got good results, as we can all see. I did the surgery 10 days ago, and we can see that she is happy and free from all the problems, including the double vision. This was another 26-year-old who had a lot of problems like the previous patients. She also had additional problem of very high plus glasses, hypermetropia. There's a plus 32 she was wearing. So after the surgery, her problems were resolved and the eyes were straight with no double vision. This child also had very poor vision before surgery and was not at all cooperative for the measurements. So it was very challenging and interesting. Surgery went on well and produced good post-op results, as we can see. Both cosmesis and vision improvement happened very rapidly. This is another young 25-year-old IT professional. You can see before surgery, eyes crossed, and after surgery, she's happy and straight. This is a doctor from the Middle East. You can see the eyes are crossed, and now after surgery, this is taken just one day after the surgery. So the eyes are still swollen up. And this was another child who had very large squints with all its accompanying problems. I am also happy to say I did the surgery free of cost for this deserving child. Post-op, this child's vision had improved tremendously, along with good cosmetic effects. Let's go on to the next topic, glaucoma. This is also known as a silent thief because it takes away all your vision without even your knowledge. So what is it? It's an eye disorder that causes damage to the optic nerve due to high or even normal intraocular pressure. And it results in blindness if you don't treat it. So it is the leading cause for irreversible blindness in the world. Please note it, leading cause for irreversible blindness. So whatever you have lost, nobody can give it back. So according to the WHO, 76 million people worldwide are affected by glaucoma. 6 million people suffering from blindness are caused by glaucoma. And glaucoma is particularly prevalent among people over 40 years of age. So how to prevent this? Early detection is very important. Most important, family history of glaucoma, that is a genetic cause. Inflammation of the eye, infection, high pressure, injury to the eye, wearing minus glass, wearing plus glass, uncontrolled diabetes, and uncontrolled blood pressure. So how to prevent? Regular eye exams, especially for 35 plus, are those with risk factors. Increased awareness about the disease. Visiting an eye doctor who is a glaucoma specialist is critical. And treatment options are eye drops, laser surgery, and glaucoma. I just wanted to show you, this is one of the investigation field test. You can see in the first two pictures, the gray scale, this is early damage. Since the patient was very negligent, you can see the damage has increased. That means these are the areas where they cannot see at all. And this is the final stage where we call this only an island of vision is left. We call this tubular vision. We can all check. Just put your hand like this and see through that small hole. That is how they all end. So it's very pathetic to treat such people. And you can see the progression of the visual field defects just over a period of 30 months, how much it is increased. Just within 30 months because patient was negligent. And this is the investigation called Humphrey's Visual Field Analyzer. And this is what we see in a patient. Just a good eye examination, fundus picture that shows a normal eye. Okay, this is called the cup. The center part, which is white, is called the cup. The cup is to the disc ratio we measure. You can see this is normal. This you can see it is increased. And this is very much increased. So when it is increasing, we know the optic nerves are getting damaged. And you can see more damage. This is what the ophthalmologists are very supposed to catch it very early. This shows a very advanced, you can see this is almost gone. And well, let's see what is an eye emergency. It's called closed angle glaucoma attack. 26 million Asians are at risk. Asians are particularly at risk. 5 million people are blind in one eye. 2 million are blind in both eyes from this. Patient comes to the emergency with a very painful red eye, which is blind or partially blind. What are the risk factors? Increasing age, females, Asian race, positive family history, refraction, that is wearing plus glasses, and short eyes. What are the precipitating factors in these patients with risk factors? Watching television or mobiles in a dark room, reading, emotional stress, inhalers, motion sickness, antipsychotic medications, and cardiac medications. So these patients who are taking these medications should visit the doctors and look for this problem. What are the symptoms? Some don't have any symptoms. Some have severe pain, headache, blurred vision, glare, and hairless looking at the lights. So how do you prevent? Regular eye checkups. And this is the laser machine. We do a hole in the iris. That's called laser peripheral iridotomy. So there is a place for draining the fluid. And we all know eyes, big eyes in a baby is very beautiful, but also beware of the big eyes. You can see this is a baby born with congenital glaucoma. I have treated many of them. And so excessively large eyes. And you can see in the third picture, the baby is squeezing the eyes because there's so much damage, not even able to look at the light. And the last one shows complete damage. And I want to talk to you about this important form of glaucoma, which is my research also. It's called pseudo-exfoliation glaucoma. This is a dandruff-like material. You can see on this edge. You have to carefully look for it. In the year 2003, I did research at the University of Toronto, Canada, and found a very high incidence of this in the Tamil population. There was a huge Tamil population, Sri Lankan Tamils and Indian Tamils living in Toronto. And I found it was very high compared to the local whites. And what is the importance? In Tamils, this type of glaucoma produced damage at a very younger age and more damage in comparison to the other types. And cataract is very difficult in these patients. Cornea becomes weak and the damage progresses to blindness very rapidly. So the importance is my research findings created an awareness among doctors to look for the problems in the Tamil population in Canada. This awareness is very important in the prevention. So millions of eyes of Tamil population could be saved. And once the glaucoma is diagnosed, the treatment can be started at a very early date and the eyes can be saved. This got me, I'm happy to say, this got me the Best Research Award in 2003 in Canada. This was the first time. This is the first time in Canada an Asian was getting this prestigious award. And since this was an important research finding, I was invited by the AAO, that is American Academy of Ophthalmology, to present this paper in Florida. And this was organized by RO, which is a very prestigious organization, research, comprising of 12,000 plus members over from 75 different countries. At this meeting only I met Dr. S.S. Badrinath, founder of SN, and he invited me to join SN where I worked for a couple of years. So let's move on to cataracts, which is very common. This is a common condition which causes blindness if not treated. So cataract is the leading cause of blindness in India. We told glaucoma is the leading cause for irreversible. That means nobody can give back. Whereas cataract is the leading cause for blindness. That means once you remove it, you will get back the vision. But still it is. So according to the latest statistics in 2020, there was estimated 64 million cases of cataracts in India. And what is it? It's a clouding of the natural lens of the eye that comes with increasing age. The symptoms will be blurred vision, faded vision, sensitivity to light, and eye pain. So what are the temporary measures? You can change the lighting conditions at home or office, then increase the font size, wearing prescription glasses. And I won't go into the details, but we remove the cataract lens and then we implant intraocular lens, which can be for single vision or for multifocal lenses. So these are the various stages showing you. This is a lens with the clear lens. You can see there's no cataract. This is immature cataract. So you can see this is completely mature. And if it is left untreated, some patients ask me, can I just leave it, doctor? So this is what, if you leave it untreated, this is what happens. Becomes an emergency and the lens has sunk in and people have to rush to the doctor. So I want to show you, just like glaucoma, cataract can come at all ages. This is in a congenital newborn baby and that is a bigger child. This is due to injury and this is age related. You yourself can see how is the white reflex and this we call it the black reflex. This is already operated. And I'll just take quick 2 minutes for digital eye strain. and how you can take few steps for good eye care and vision. What is it? It's a temporary vision condition caused by prolonged use of electronic devices. What are the symptoms? Burning, itching, headaches, fatigue, and loss of focus. So what is it? Symptoms include blurred vision, double vision, and head and neck pain. These symptoms may be caused by poor lighting, glare on the computer screen, improper viewing distances, poor sitting posture, uncorrected vision problems, or a combination. So, how do you diagnose? Can be diagnosed through a eye exam. So, some statistics, American adults and digital device. What adults are saying? 55% use digital devices for 5 hours or more. 57% experience vision problems. And 14% only, that's very less, take a break from work every 20 minutes. So parents are also very misled. They underestimate the time the children are spending on the digital device. See, 83% of the children are using the devices for 3+ hours, but only 40% believe the kids use an electronic device for only +3 hours. So there is a significant disparity. So this is to warn all the parents. And 80% of children experience burning or itchy, tired eyes. So this rule is very important, 20-20-20 rule. Every 20 minutes, take a 20-second break and look at something 20 feet far away. And this is a picture I got so that you can adjust your posture, check the height and position of the device, check for the glare, reduce the amount of lighting in the room, keep blinking, that's very important. And comprehensive eye exams are important. And the children need to have an eye exam. Abroad we used to do from birth every 6 months, or at least before the age of 3, every 6 months you should do. And adults need to see the doctor yearly. Thank you all. Free to take any questions. Thank you.
Can you hear me?
Yes.
This mic is it working? Yeah. Thank you, Uma, for your information. She's given a lot of exhaustive information in a nutshell. And she has covered so many important topics because we sometimes just take our bodies for granted. We take our eyes for granted, our digestion for granted, everything we take for granted because this body is such a beautiful machine, it just keeps doing no matter what use or abuse we do with it. In fact, I am very pleased to say that she has operated the cataract in both my eyes. And I was wearing glasses, reading glasses from the age of 38 till 2 years ago, 3 years ago, and now no glasses. So I've got intraocular lenses. And so don't neglect yourself. The whole idea of this whole sessions that we are having is to tell you, remind you that like everything, you take better care of your cars and your computers than you do of your body. To remind you that the body needs care. So please feel free to interact with her, ask her some questions. We've got another 5 minutes. We can, before the next session, please go ahead.